This is Cancer 101, the fundamentals of cancer. In my previous video, I discussed chemotherapy and the anxiety that people have about chemotherapy. And I want to add to that discussion today by discussing three different things that will help you better understand why you may or may not want to take chemotherapy as your doctor has directed. First, we're going to talk about DNA repair in healthy cells versus cancer cells and the difference between the two, because chemotherapy damages DNA and causes the cell to die. The second topic is I want to talk about the idea of your immune system and that chemotherapy may harm your immune system. And so why would you want to take chemotherapy if it's going to damage your immune system? And then I want to discuss the long history of clinical trials that these chemotherapy drugs have gone through. Sometimes decades and decades of hundreds of trials, maybe even over 1,000 trials for any particular drug. And so let's start with the first one, DNA repair. So the way chemotherapy kills a cancer cell, as I talked about in my last video, it damages the cell in some way during one of the phases of its cell cycle, G1, S, or G2, or the M mitosis phase. And typically, when it damages the cell, what it's doing is damaging the DNA in the cell, which leads to the cell eventually dying. And so that's, since cancer cells rapidly go through these cell cycles, since they're dividing very rapidly, you kill a lot more cancer cells than you kill healthy cells, although occasionally some healthy cells are affected. But even if a healthy cell is damaged by the chemotherapy, a healthy cell has normal functioning mechanisms of a healthy cell. Part of that is cell repair. So there are various ways that cells can repair themselves. They get damaged. For instance, their DNA gets damaged somehow. And the cell can actually go in and snip out bad sections and rebuild those sections and fix DNA in other ways. And so a healthy cell is actually able to repair itself and continue on existing and performing its functions as normal. The good thing about cancer cells is they're damaged cells, they're abnormal cells. They don't function in the way that they're supposed to function. Some of their functions are too good, in other words, replication. They're able to replicate like crazy. Whereas other functions are damaged by the existence of the cancer cell. And so they're not able to repair this DNA damage that the chemotherapy does. So again, the cancer cells are preferentially killed over the healthy cells. And so while some healthy cells are killed, that's true, a whole heck of a lot more cancer cells are killed. And of course, that's the idea of chemotherapy. Now, the second issue that I want to talk about is one that comes up a lot with cancer patients, and that is they say, well, why would I want to damage my immune system? And it is true that many chemotherapy drugs, you could say, temporarily damage the immune system. For instance, they lower the number of neutrophils, white blood cells, in order to fight off infection, those kinds of things. So it can have that effect. Here's the big question. You already have cancer before you ever had the chemotherapy. In other words, your immune system was already not functioning, so to speak, and that allowed you to develop the cancer. So where was your immune system before you ever had chemo? Well, obviously it wasn't functioning that well. And so your immune system is probably not going to save you no matter what you do. And that's why you need the chemotherapy. As I explained previously in my last video, the problem with the immune system argument, an additional problem, is that your cancer cells are your own body, they're tissue from your own body, and therefore your immune system, which typically goes out and attacks foreign invaders like bacteria and viruses, is not going to go attack those cancer cells. Why? Because they belong to you. Those are your own tissue, your own cells. Even though they're cancer cells, they still look enough like your own healthy cells that your immune system is simply not going to attack them. And so therefore worrying too much about your immune system is not helpful in this regard, in particular about cancer cells. Now, harming your immune system is a concern in that you don't want to get other diseases or problems. You don't want to get a bacterial or viral infection while your immune system is low after receiving chemotherapy. And so the doctors are careful about that. They're careful about measuring your white blood cell count. That helps you fight off infections. And if it gets too low, they typically give you drugs that will generate more white blood cells, and of course tell you to protect yourself from any infections, or for instance, family members who have a colds or whatever kind of infectious disease they might have. But those are infectious diseases. Those are agents coming from outside of your body. They're not your cancer cells itself. And so your immune system has very little effect in trying to fight your cancer. And the main evidence for that is that you have cancer in the first place, and even though you haven't received any chemotherapy. The final thing I want to talk about is you have to recognize that cancer has a long history of clinical trials, thousands upon thousands of clinical trials using chemotherapy drugs. And they don't just see what happens to one patient or two patients. They often will have dozens of patients in each arm of the trial. One group of patients will receive the best standard treatment of the day, and the other group will receive the new treatment, which may include chemotherapy or whatever. And then they compare them. They compare patients who are getting one treatment option versus patients who are getting another treatment option. And so what they've done is, in the course of these trials, over literally decades, they've been able to narrow it down to certain patients who do well with chemotherapy, who are advised to take chemotherapy because it does improve their 5-year survival statistics, for instance. And a typical example, I'll just give you one, but in colon cancer, after decades of studies, they found that stage 1 and stage 2 colon cancer patients typically just need surgery. They don't need chemotherapy. They've tried chemotherapy in those patients, and what have they found? The chemotherapy doesn't help. The chemotherapy doesn't add to your 5-year survival. And so therefore, they now have strong evidence to say, we don't think you should take chemotherapy if you're a stage 1 or 2 colon cancer patient. Surgery is enough. But what about stage 3? Well, stage 3, the cancer has already started to spread away from a more localized situation. And that's what chemotherapy does, is it chases those cancer cells not just in the local area where the tumor occurred, but it chases them throughout your body. So anywhere the colon cancer cells might have spread, like to your liver or bones or lungs, which are common sites of the spread of cancer, the chemotherapy goes throughout your body, searching out these cancer cells and trying to kill them. And so in the case of stage 2 colon cancer versus stage 3, it's clear that in stage 2, after many, many studies, adding chemotherapy after the treatment of surgery does not help you. But in stage 3, it's also clear that adding chemotherapy after surgery really does help you. It improves your chances of survival. And that's not just based on a whim, that's based on millions of dollars spent setting up very carefully controlled clinical trials over 20, 30, 40, even 50 years. For instance, 5FU has been around for, 50 or 60 years at least. And they're still doing studies on 5FU. And so the argument that, why would chemotherapy help me if it's damaging my immune system, or I just don't believe it's going to help me. your oncologist would not recommend chemotherapy. He doesn't want to put you through that, those side effects, the nausea, the vomiting, the fatigue, and so forth, unless he felt it really would statistically help you. In other words, he can't say exactly what's going to happen to you, but based on large groups of patients in many, many clinical trials, patients with the chemo do better than patients without the chemo. So whether it harms your immune system or not doesn't really matter. What matters is, if you take the chemo, do you do better? And the answer is, if the doctor is offering chemotherapy, then yes, you probably will do better taking the chemotherapy. So those are some thoughts about chemo and different ways to think about this treatment approach, which of course scares a lot of people and causes a lot of anxiety. But it's important to think carefully about it and rationally about it. We'll see you in the next video. I hope this was helpful. And if you like this channel, please subscribe. If you like this video, please click on like. Thank you very much.